Educators are talkers, and it's a good thing because words are extremely powerful. However, if your words communicate poorly supported assumptions or are used mostly for criticism or formed into threats, they can be quite harmful. When your words are informed by understanding and empathy, they become therapeutic, and nothing beats words except perhaps actions. Talk to get your student talking. Okay, help me understand. Here's what I see, but what's going on inside? Talk that communicates recognition and understanding builds trust, and it encourages exchange. Oh, now I get it. Sometimes when you don't seem to want to try something new, it's not because you don't want to, it's because you have that feeling. I get that sometimes. I think it's called anxiety, and here's what I understand about it. Give it a name. Call it anxiety, or that weird feeling, or the big A, or the uh-oh feeling. Give it a face. Younger children can write or draw about it, the anxiety monster. Help older kids step away from the problem and see it as something external to their identity. Anxiety is not who you are. You're just a person with anxiety. And anxiety is a problem. It's simply a problem we can learn to work around. Teach about it. Teach deep breathing, progressive muscle relaxation. You can call it yoga or use parts of the brain gym and have everyone do it. Also, keep your eye out for books and movies that have examples that carry therapeutic messages. These can be very useful too. Talk is important, but what you do is key. As the saying goes, you can talk the talk, but you gotta walk the walk. I know, time is one of the many things in very short supply. Try to think of practical interventions and accommodations as investments of time. Invest time now and compound those time-saving dividends later. Anxious kids require extra time to adjust to things, so be patient. They have trouble with transitions. They may need a lot of extra help. They often require extra attention for supervision and observation as well, and you may have to invest time with a team of educators or other health professionals to come up with an individualized plan. There's no getting around it. It's time-consuming. Here are a few accommodations that invest some of the time you will need for trust building and implementation of other interventions. Add time bumpers on the day. A little extra time to transition in, a little extra time to transition out. Perhaps you can meet the bus in the morning or walk the anxious student to the bus in the afternoon occasionally. Plan a 60-second AM check-in with the student who's struggling with anxiety. This is a good opportunity to express some positive expectations about the day and to get a read on demeanor. Perhaps have the student with anxiety be the teacher's helper, run errands, etc. If you have the flexibility to stay after school with the student, make it about relationship building and not necessarily about extra help, at least at first. If you happen to supervise an after-school activity, see if you can invite your student with anxiety to join. Practice tests can be very helpful to the student with performance anxiety. The setup is, let's have you stay after school and take a practice test. It isn't the real thing, but guess what? Any of the answers you get right, they'll count. This is often the hardest aspect of relationship-based intervention. Anxious students often expect others to just give up and avoid the problem because that's what they do. That's not what you're going to do. This one's on you. Key skills necessary for adult maturity include the abilities to plan ahead, persevere in the face of frustration, delay gratification of rewards, and adjust to complications. If your interventions are guided by good information and based on a relationship of positive regard, trust, communication, then stay the course. Show them how it's done. But if your interventions have become stale, or if they are sort of one size fits all, or if they presume a level of trust that hasn't been built yet, or discount the basic value of relationships, then step back and take a hard look at them. Either way, don't give up. It takes tenacity. Once you've developed that trusted relationship, you can leverage it to introduce some interventions and accommodations that will help the student with anxiety develop adaptive skills to be more successful in and out of school. And that's what it's all about. In part 1 of The Anxious Student, we discussed some of the biological, psychological, and social aspects of anxiety and described a few of the many behavioral presentations that this common emotional problem takes. Our goal was to help you understand anxiety. In part 2, we discussed the fundamental foundation of all successful intervention plans, relationship. Remember, all of us look at the world through our own invisible glasses. We'd like to have you think about yours and imagine theirs. Part 2 focused on the 5 T's of relationship-based intervention. These are tenderness, trust, talk, time, and tenacity. They aren't technical psychological concepts, and they aren't fuzzy. But they are essential to the success of your plan, and the good thing is that they're already in your toolbox. We hope that Part 2 reminds you to look at each aspect of relationship and leverage it to its full extent, because you are the most important tool in that toolbox. We hope you will join us for The Anxious Student Part 3, which focuses on skill-building interventions, documentation of these interventions for individual education plans and 504 plans, measurement of response to intervention, and collaboration with other team members. Thanks for watching, and be sure to check out Part 3.